Thank you everyone for joining the DocShop Pro webinar this evening. It looks like folks are still getting set up. While they do, a few housekeeping notes. Everyone is muted. Questions can be submitted as we go, and you can utilize the chat throughout. This webinar will be recorded for future distribution. I see some familiar names and some new ones as well. Thank you again, everyone, for joining, and welcome. Tonight's topic is maintaining profitability amidst and despite the COVID effect. Leading us this evening will be Dr. John Guiliana. So, who and what is DocShop Pro? So, many of you are already familiar with DocShop Pro, but for those that aren't, we're a way to one-stop shop platform for your office. We were founded by physicians, for physicians, and you can use our platform to cross-comparison shop for daily supplies, find ancillary products and capital equipment. You can utilize our partner programs for diabetic shoes and custom AFOs, and we can even help you find new patients. With our My Supply Manager, you can take advantage of the process for reordering supplies, brand names and generics across dozens of different vendors and manufacturers, something that's often an hours-long chore, and transform it into something that you can do in single-digit minutes. In fact, we even carry some of our competitors' products. And almost always, we can save you some money along the way. With our inventory management system, you can track inventory, monitor par levels, even if you never order anything from our site. It's designed to be very plug and play for workflow and staff changes at your office. We can help with protocol standardization, vendor consolidation for all of your orders. You have instant access to supplier catalogs with negotiated pricing. We help thousands of physicians all across the country get access to discounts and then pass those savings along to you. Right now, we're also offering 6-month deferments on capital equipment. There's no costs, there's no fees, no commitments. Registration is totally free, and we can perform a free cost analysis anytime. So we're here to help you save money, and we're here to help independent practitioners remain independent. This evening, we're joined by Dr. John Guiliana, a doctor of podiatric medicine, an experienced national speaker, author, co-host of the Essential Adaptations podcast. He's a renowned practice management consultant and the executive vice president at Nemo Health. John, I'm going to pull down my slide here so you can take over. And the floor is yours, sir.
Thank you very much, Greg. I hope everybody is seeing my screen right now. What I'm going to be doing shortly is put a lid over my camera lens because there's a little bit of a delay in what I'm seeing, and I know that's going to drive me absolutely insane. I'm going to take only about 25 minutes or so of your time tonight because I know that everybody is suffering from webinar fatigue. So I'm going to keep this straight to the point. And what my intent really is going to be is to take what Greg said and put it into an economic perspective for you. It's great hearing, no offense, Greg, it's great hearing a salesperson talk about why you should use their products or their services. But what I want to show you is how to actually look at this in an economic perspective so that it makes sense to you and you really truly understand why using DocShop Pro is something that you absolutely should not neglect. So let me put a lid on this and we're going to get started. First, I want to embellish a little bit about what Greg went over about my bio. I'm the executive vice president of Nemo Health, as Greg said, as well as Podiatry Risk Group. Many of you know that Nemo Health is the owner of the podiatry-specific electronic health record known as TrackNet. TrackNet's used by more podiatrists than any other electronic health record. Nemo Health also owns Nemo Medical Billing, which is a podiatry-specific billing company for podiatrists who choose to outsource the complex processes associated with medical billing. And lastly, Podiatry Risk Group. Podiatry Risk Group owns an innovative voice recognition software known as Speakeasy. Speakeasy can be used with any electronic health record, and it helps create extremely efficient chart notes that contain the LCD verbiage, that's the local coverage determination verbiage, that auditors frequently look for. And we all know how these audits are ramping up significantly lately. So this not only optimizes your charting process, but it significantly helps reduce audit losses. So that's really who I am. Hopefully what I'm going to go over tonight, what this information is going to contain, is going to help you make more prudent business decisions in your day-to-day operations of your podiatry practice. I'm going to review some key strategies to help you understand your practice's profitability and the economic principles that may help you work smarter and not harder. And it'll all drill down to how DocShop Pro is perfect for that. You know, as a consultant, as Greg mentioned, I frequently see doctors who are faced all the time with challenges, and they're looking only at the surface of these challenges to seek a solution. Now, typically that leads them down the wrong pathway, and they wind up attributing their problems to things that are sometimes rather irrelevant. Sometimes we blame people. Sometimes we blame policy. Sometimes we blame the economic environment or politicians or healthcare carriers. But it's important that we really see the root cause of challenges before planning and executing a strategy. In essence, we can't jump to conclusions and focus on X when Y and Z are the real problems. We have to respond intellectually to challenges and not react emotionally. And I know that we're in a state of crisis. Many practices are in a state of crisis right now. And who knows where the next several months are going to take us. But we still have to make sure that we remain emotionless and respond intellectually. And really, this is a choice solely up to you. So let's dive in by understanding some things about profitability and your practice's cost. Many of you probably recognize this document as, well, it's a rather primitive profit and loss statement or income statement. This is a document that highlights the financial health of your practice over a period of time. The top of the document highlights your revenues or collections. From that, your cost of goods sold is subtracted, and your gross profit is therefore computed. Then the document lists all of the expenses that you incur that are necessary to generate the revenues. And I'm sure your profit and loss statement looks drastically different, with many more categories of expenses. Lastly, your gross profit minus the expenses lead to your net income or net profit. And you'll see why I wanted to show you, albeit very primitive, you'll understand why I wanted to make sure that you understand a profit and loss statement very soon. In my experience of helping several hundred different types of podiatry practices, I can tell you that by far the most costly expense is naturally your staff. And while there are many smaller expenses that occupy less than a fraction of 1%, your clinical supplies and clerical supplies can amount to sometimes almost 10% or more of your revenues. So even a small reduction in that percentage can be extremely impactful to your bottom line. Now, going back to that profit and loss statement, on that profit and loss statement, you have both fixed expenses and variable expenses. You also have some expenses that are truly not operational expenses at all. For example, automobile expenses, meals and entertainments. These are not true operational expenses. They're sort of perks that are allowed as business deductions per the IRS. And again, you'll understand why I'm setting this stage very shortly. Fixed expenses are those which don't vary with output. Now, for us, output simply means patient volume. So fixed expenses are those which do not vary with output or patient volume. Variable expenses are those which do vary with patient volume. So fixed costs are things like your rent, insurance, executive salaries, etc. Variable costs are those things that vary with patient volume, like your medical supplies, your staff salaries to some extent, utilities, lab fees. and something very impactful on our medical practice, which is known as opportunity costs. And I'm going to emphasize this because you're going to see how this even plays a role with DocShop Pro. You know, many managing partners or administrators of medical practices, they frequently neglect to consider opportunity costs as part of their operational expense. So opportunity costs are basically defined, and this is strictly in economic terms, as the cost of an alternative foregone. For example, if you invest in product A, it's not just the cost of product A that you need to consider. It's also what you might lose by not investing in product B. Similarly, if you're doing X, Y, and Z, it's not just the outcome and the time spent on X, Y, and Z that matters. You also have to consider in your cost calculations what in fact it cost you by not doing an alternative A, B, and C, which might bring a whole different subset of perhaps even better and less costly outcomes. Now, on your profit and loss statement, what I'd like you to do, and this is an exercise that I really hope you take me up on, because you're going to see how it really impacts your profitability now during a time of crisis and even long after COVID is over. You're going to see how this can impact your business making decisions. What I'd like you to do with your profit and loss statement is, first of all, cross off all the costs that are not truly operational costs, like your meals and entertainment, etc. Then in one color ink, I want you to circle all of your variable expenses. In a different color ink, I want you to circle all of your fixed expenses. And you'll see why this exercise is important very shortly. Now, let's dive into a conversation regarding your revenue and your costs. And I'm sure you realize that profitability can either be increased by increasing revenues or by decreasing costs. Revenues and costs are really just the opposite side of the same coin. In raising profitability, you actually have twice the leverage of doing so by focusing on costs as opposed to increasing your revenues. Think about that for a second. You have twice the leverage of raising your profitability by focusing on cost as opposed to increasing your revenues. If you, for example, increase your revenues, some of those revenues are going to get cannibalized by the variable costs that are consumed. I think that makes sense. So for every dollar you raise in revenues, you might only get to keep 75 cents of that dollar. But when you decrease costs, for every dollar you decrease in costs, you get to keep the entire dollar. So that's what economists refer to as leverage. So it's great to expand your revenues, but it's much more impactful to focus on costs. So it's important that you understand, before we really get into the cost side of that coin, it's important that you understand some metrics to govern and manage your practice's cash flow. Because right now, with reduced volume, and I say this from the fact that I'm working with several hundred practices through Nemo Medical Billing, and the typical practice has recovered somewhat from the troughs of COVID, but most are only back 80 to 85%. So there's still a huge gap in their capacity, and that hurts that bottom line. So it's important that you understand some of the metrics to really focus on your cash flow, because there's nothing more important than your cash flow right now. These include your practice's margin, which is easily computed by gross profit divided by your revenues. Think of margin as the inverse of your overhead. If your overhead is 65%, then your margin is 35%. But as I mentioned, you also need to know your fixed and variable expenses. You should also know your total cost per patient. Now, this is computed by knowing what your fixed and variable operational expenses are and totaling them up, and then dividing that by your patient volume. Your patient volume should be easily accessible through your practice management software. Dividing the total cost by your patient volume gives you your total cost per patient. Then the next important metric that you should know is your variable cost per patient. This is strictly those variable costs divided by your patient volume. That's why I had you circle the variable cost in a completely different color ink. And lastly, you should know the average reimbursement of your top 10 CPT codes for your top 5 payers. Again, your top 10 CPT codes for your top 5 payers, the average reimbursement. Now, let's put those metrics to work and talk about the revenue side of the coin of profitability. If the average reimbursement of any of your top CPT codes falls above your total cost per patient, that's an ideal range. That's hopefully where many of your CPT codes lie. If your average reimbursement of your top CPT codes fall between your total cost per patient and your variable cost per patient, well, that's an acceptable range. It's not ideal, but it's definitely acceptable. But if your average reimbursement of your top CPT codes for any carriers fall below your variable cost per patient, that's an unacceptable range. In this range, it literally means that each time you see a patient with that CPT code for that carrier, you are operating at an economic loss. Now, I want to qualify something about this and about these CPT codes. There naturally might be a CPT code that routinely falls below your variable cost per patient, but it doesn't represent necessarily an ominous situation. A perfect example of this are your radiology codes, 73620, 73630. I could almost guarantee you that the average reimbursement of these codes fall below your variable cost per patient. But that's okay, because these codes are often joined with other codes, such as an evaluation and management code. So it's really the sum of those two codes that you should use to assess what range it lies in, whether it's in an unacceptable, acceptable, or ideal range. Additionally, once you decide which contracts are winners and losers, so to speak, it doesn't mean that you're going to immediately terminate those carriers which have CPT codes reimbursing less than your variable cost per patient. The reason for this is that you need to consider what economists also call externalities. Externalities are those economic entities that either have a positive or a negative effect on any business decision that you make. So, for example, it would be a rather significant negative externality if you decided to drop out of a payer because they are routinely reimbursing below your variable cost per patient for some CPT codes, and then wind up having your referral patterns from your primary care physicians change drastically as a result of that decision. You know, naturally, many referring physicians want to have the ability to refer everybody to you, not just patients from select carriers. So that would be a perfect example of a negative externality that you need to consider. But having the knowledge and the information as to what codes are operating you at an economic loss is powerful, because then you can make some decisions. Should you outsource, for example, those particular CPT codes? So that covers our discussion on profitability and cost. But now I want to turn this to discuss price versus cost as we drill down to really prove what Greg was talking about regarding DocShop Pro. There's clearly a difference between price and cost that I'd like you to understand. And I think the best way to help you understand it is to give you an example. Let's suppose you buy a gallon of gasoline at $1.99 per gallon. How much did that gallon really cost you? Well, you might say it cost $1.99. However, let's assume just for a moment that your total federal tax, your federal income tax, your state income tax, your local tax, Social Security, comes to about 35% of your salary. That means you actually needed to earn $3 in order to pay for that $1.99 worth of gas. So while the price of that gallon of gas is $1.99, it actually cost you $3 worth of sacrifice. That not only represents a perfect example of price versus cost, but to some extent, I think it also helps you understand what I talked about before, opportunity cost. So for example, your medical supply management comes at a price, which is the price of your medical supplies, but it also comes at a cost, which involves the cost associated with the process of ordering your medical supplies, such as human resource time, etc. If they're doing A, they can't be doing B. It's the cost of an alternative foregone. The total price and opportunity cost is actually much higher than just the price of your medical supplies. This is exactly why DocShop Pro is such an easy decision. It not only lowers your price of medical supplies, but it also lowers the associated cost of medical supply management. So in essence, there are really three options for reducing medical practice overhead. And again, you want to capitalize on leverage here. You can increase productivity, meaning getting more bang for the buck, which naturally lowers your relative overhead ratio. You can reduce costs directly, getting the same bang for less bucks, or you can improve business processes and operations, getting more bucks for the bang. And remember the concept of leverage. Only number 2 and number 3 in this list will give you the optimum increase in profitability, since there's no associated variable expenses that you're going to incur in number 1 of this list. Increasing productivity, well, some examples of that would be things like the development, management, and measurement of clinical protocols. And hopefully, after listening to me for many years, you're doing that by now. Or it could mean expanding your footprint into new geographic locations. But remember, these things come at a cost. Reducing costs, however, would involve things like using DocShop Pro to not only get better supply pricing, but also improving the business operations, number 3 in this list, to get more bucks for your bang. So in summary, I just wanted to list some things that I think are good cost containment strategies to help you really get through this crisis. And hopefully you're going to utilize this even long after COVID is gone. You should be reviewing your staffing needs right now and adjusting its size as necessary. Payroll is probably the only line item on your profit and loss statement that exceeds your medical supply costs. So you should assess and systemize staff levels and even compensations. You should look for savings on health insurance. Shop around for health insurance. Develop or refine your sick leave policies, vacation, overtime policies. Scrutinize the cost effectiveness of outside services. And look for ways to economize on even simple things like postage and telephone charges. Review your practices advertising for waste and ineffectiveness. Remember that whenever you advertise or market, you should absolutely know the return on that investment. It's a measurable that you absolutely should know. Otherwise, once again, that process could be causing you to have an economic loss. And lastly, of course, what this webinar is all about, optimize the ordering and handling of your medical supplies through DocShop Pro to not only be cost effective, but also lower the price of those medical supplies. Greg, this is my email that I'll keep up there for a while in case anybody has any questions, but I'm also happy to entertain any questions that you all may have right now.
Sounds great. Thank you, John. We really appreciate that. Appreciate everyone joining. We're happy to hang on for a few minutes if there are any questions. You can utilize the chat as well. So we'll obviously be posting a replay of this event as well. We're excited to help support you, work with you however we can. Again, we're happy to do a cost analysis anytime as well. You can always reach out to us. Just go to DocShopPro.com, submit your information, and one of our reps will be in touch. All we need is a couple invoices, and we can start crunching the data and show you what we can do. And then we'll load all those products into a supply list for you so you're up and running and ready to go right off the bat. So if there's no other questions, we will let you guys go back to your evenings. Thank you again, everyone. Be safe and have a great night.
Thank you. Have a great night.
Thanks, John.
Anytime.